Namaste, ma'am. Hari Om. Panchajanya, the divine conch of Bhagwan Shri Krishna, which was blown during Kurukshetra, indicating the start of the Dharma Yuddha that followed. There, all the efforts were done for the establishment of Dharma. Dharma was kept over personal relations and motives. Keeping the same motive in mind, our organization will work towards establishing the importance and necessity of following and imbibing Bharatiya culture and accepting our roots and making people realize the true essence of Ayurveda, not only as a treatment modality but also as a way of life. All this while walking in the path of Dharma. Hence the motto Shreyam Bharatiyam Arogyam Ayurvediam. The founders of this organization started this because we felt the need to spread the knowledge of Bharatiya culture, Ayurveda, the true history of Bharatrashtra and values to all strata of people in every corner of the world. So, in order to achieve this, we have 10 wings. Team Ahilyabai, wing Swami Vivekananda, wing Karnatavala, wing Govardhana, wing Ashwins, wing Narada, wing Kautilya, wing Vedavyasa, wing Nalanda, wing Sanjaya. All assigned with the specific task. So this lecture and note series is an initiative of Wing Vedavyasa. So today we have Vaidya Vijayalaxmi Mallannavar, BMS, MD, PhD with us, Associate Professor, Department of Komarabhriti, SDM College of Ayurveda and Hospital, Hassan. Ma'am has 14 years of teaching experience and guided 16 PG scholars and 2 PhD scholars. Ma'am has presented many research paper presentations in national, international conferences, seminars, and invited as a resource person in national and international conferences. Ma'am has delivered lectures and demonstrated pediatric panchakarma procedures to short-term courses. Delegate Ma'am has been delegated from India as well as abroad Ayush doctors. Ma'am has delivered many public awareness talks and conducted school health checkup camps and organized many seminars and workshops. Ma'am, we are very glad to have you on the session today. Over to you, ma'am.
Thank you. Good morning, everybody. Myself, Dr. Vijayalaxmi, Associate Professor in the Department of Kamaravidya at STM College of Ayurveda and Hospital, Hassan. So today we are going to deal with the topic Kuposhanajanya Vyadhis, that is nutritional disorders in children. So children are considered as priority group because the health status of adult population is the continuation of the health status of children. And as we all know, 37.3 percentage of the population is covered by children only. So optimal nutrition is essential for the child survival as well as for the quality of survival. Nutritional status of the children is indicator of nutritional profile of entire community. Hence, preservation of children health is the prime duty of the humanity. So, coming to the topic, malnutrition. Malnutrition can be considered as overnutrition or as it can be considered as undernutrition, but generally malnutrition is considered under the category of undernutrition. So it is one of the very major health problem in children. And whenever we study about malnutrition or undernutrition, the term protein energy malnutrition, that is PEM, is generally considered as the standard term for malnutrition in children. So prevalence of PEM in children is in India, 47% of children are suffering from varying degrees of malnutrition. In that, major share, that is two-thirds, are of preschool children, and PEM affects every fourth child worldwide. So spectrum, this every fourth child, it may be varying degrees of malnutrition. Like some maximum may be in the mild to moderate category, whereas very few may be present in the severe forms of malnutrition. So whatever, many suffer from invisible malnutrition. Those cannot be detected very easily. That is mild to moderate malnutrition. So effect of malnutrition. Malnutrition is the one of the major cause of morbidity and mortality in children. That is, many children suffer from other diseases. Along with that, if there is malnutrition, then the mortality or the morbidity of the condition increases. That is, 54% of the childhood is because of malnutrition. Childhood deaths are because of malnutrition, whereas acute respiratory infections and diarrheas are only 20 and 18%. So malnutrition is one of the major cause of morbidity and mortality in children. Along with this, malnutrition is also having its effect on growth and development. If the child is properly nourished, the child will grow very healthy. If the child is malnourished, his growth and development will be hampered. It also diminishes the immunity as well as increases the mortality and morbidity. As the child's growth will be hampered, as the child's immunity will be low, it always interferes with the school performance, and it impairs the daily activities or the daily functions of the body. So mainly three times or the three categories are there where the child generally falls into the category of malnutrition. The first one is during the weaning period. Weaning period means at the time of 6 months to 1 year. Generally, till 6 months, the babies are mainly fed with the breast milk. So all the nutrition demands or the nutrition requirement will be taken care by the breast milk if the child is fed with the exclusive breastfeeding. And at 6 months, generally, along with the breast milk, the semi-solids are started. That period is considered as weaning period. If the weaning is not done properly, if early weaning is done or delayed weaning is done, or if the weaning is not done properly, then first time the child may fall into the category of malnutrition. Second is during the preschool period, that is between the age of 3 to 6 years. So till 3 years, generally the kids are at home, and their requirements, needs, everything will be fulfilled by the mother or the caretaker. And once the child start going school, they go from the home to the external environment. For the first time, they have to eat themselves, they have to go get up early in the morning, they should get ready and go to the school. So their nutritional status, and they have to adjust to the external environment, external people and all. So during that time also, generally kids fall into the category of malnutrition. And during adolescence, there is always the growth spurt. Growth spurts means suddenly there is increase in the growth, increase in the height, weight. So their requirement, the need increases during adolescence. If during adolescence the proper nutrition supply is not done, then the child may fall into the category or the pit of malnutrition. So it is very important to give proper nutrition throughout the childhood, but mainly during these three periods, that is weaning, preschool and adolescence, we need to give extra care. Then, as per Ayurveda, we don't have any separate chapter called as Kuposhanajanya Vyadhi, but there are scattered references highlighting the nutritional disorders in children. Those are like Garbhashosha, that is intrauterine only. There is, if the mother is not nourished properly, the baby may not grow properly. So that is explained under the heading of Garbhashosha. Next, after birth, like Parigarbhika, Balashosha, Dorbalya, Phakka, and Karshya. These are the diseases which are explained under the category of Kuposhanajanya Vyadhis. So first we'll see what is Garbhavapat. So Garbhavapat may be because of whatever reason, maybe maternal nutrition, or maybe because of maternal illnesses, or not following the Garbhini Paricharya, whatever. The baby inside the womb is not growing properly. Matuhu kukshim na purayati mandam spandayate cha. That is, the baby inside the womb is kukshim na purayati, not growing very healthy, not filling the entire kukshi. Mandam spandati, the development is slow, the movements are slow. That is considered as one of the Garbhavapat, where the baby is not growing properly. So in the same way, we get different names, but explanation is almost same, like upavishkaka, Lina Garbha, Vatabhipanna Garbha. Everywhere they have explained that baby is not growing healthy. Fetus not grows properly, stays in the uterus for the long time. So these all can be compared with intrauterine growth retardation. That is, the baby is not growing, the retarded growth is there. Then small for the gestational age. For that particular gestational age, weight of the baby is less, so it looks very small for that age. So these all are considered can be considered as the baby, the start of the baby is only hampered. Baby but at the time of the birth only is small. At the time of the birth only, baby is having low birth weight. So these may be because of maternal nutritional status, maternal placental condition, placental insufficiency, or maternal drug abuse. Anything can be considered as the reasons. Next, after birth, they have explained about stanya dushtis. If the stanya is prakrita, or it is in the optimum stage, the baby will grow very healthy. Avyahata banga, avyahata anga. That is, if the shuddha stanya is there, then the baby will grow healthy. If the stanya is doshita, that too, especially if it is doshita by vata dushti, then the baby will not grow healthy, is the explanation explained in the classic. Tatra ya balasya mata va dhatrim ruksham, that is, if the mother of the baby who is feeding the baby does all vatakara ahara viharas. So her vata will be prakupita and it does the dushana of the stanya. And if the baby drinks that stanya, then baby will not grow healthy. That is laghu atriptikaram. That stanya, vataja stanya is laghu and atriptikara. It is not what nutritionally having all the components, and it is atriptikara. It not satisfies the hunger of the baby. Karshanam, it causes karshana. It leads to the weight loss. Vata vikara and krit, it also causes that vata vikara. So the baby is not growing healthy here. Next, we have Pathaja Dushti under the category of Ashtastanya Dushti, like Vairasya, Fena Sangata, and Rauksha. In this also they have explained like Virasam Vata Sansrishtam Krishi Bhavati Tat Piban. That is, if the baby drinks the Vairasya Stanya, then Virasam Vata Sansrishtam, as it is not having the taste, so baby does not drink it and it will grow Krishi Bhavati, it becomes Krisha. And krichrena vivardhate, the growth is hampered, the baby will grow very slow. Okay, so it is mentioned at the start only. If stanya is shuddha, then only the baby will grow very healthy. Next, we have explanation like Balashosha or Kumarashosha. So these are the three main diseases: Balashosha, Parigarbhika, and Phakka, which are clearly mentioned about the features of malnutrition. So first one is Balashosha. As the term it only telling, it causes shoshana of the sharira. It dries up the body. Baby will look very dry, emaciated. So what are the nidanas? Like Atyaha Swapna, Shitambu Shleshmikam Stanya Sevinaha. That is Ati Ahaha Swapna, excess of day sleep. Shitambu, that is drinking excess of cold milk or cold items, diluted milk. Or it can be considered as if the baby is given with a delayed weaning and all. Shleshmiko Stanya Sevinaha. If the mother's blood is dushtita with kapha dushti, kapha dushti, as it is having kapha dushti, it will be having ati snigdata, ati guruta, so the baby may not digest it, so there may not be proper absorption of the milk, whatever given. Okay, shishoho kafena ruddheshu, srotasasu rasavahishu. So shishoho kafena ruddheshu, the baby drinks this milk as it is Lashmika Stanya Dushti, the Kapha Vruddhi will be there. And this Dushita Kapha, Vruddha Kapha will cause the blockage of Rasavaha Srotasas. So, as Rasavaha Srotasas are blocked, there is Uttara Dhatu Poshana will be hampered and the baby will not grow healthy. Along with that, because of the Kafadushti, because of the Nidanas, there are other features like Arojaka Pratishaya Jwarakasascha Jayata. The baby will repeatedly suffer from Aruchi. So the baby is not taking food. Pratishaya, Jwara, Kasa, repeated illnesses will be there. So because of Uttarottara Dhatukshaya as well as because of sufferings of these diseases, Kumaraha Shushyati, the baby will become emaciated. It will not grow healthy, will not gain weight. Tatha snigdha shukla mukhekshanaha, and the baby will become pale. It looks anemic. The extremities are very pale in color. The conjunctiva will be pale. Shukla mukhekshanaha. The face also looks anemic. Okay, these are the features of balashosha. If the baby drinks Dushita Stanya, that is Shlashmika Dushita Stanya. If the baby is taking excess of day sleep, consuming excess of cold things and all, the kapha vriddhi will be there. That kapha vriddhi causes blockage of rasavahasrotasis, and because of this there is uttara dhatukshaya. Along with that, because of the kapha vriddhi, the baby will suffer from kaphaja disorders like arochika pratishaya dvarakasa, and because of all these things there will be shoshana of the body. This is kumara shosha. Okay, next coming to chikitsa. As here mainly the kafadushti is there, stanyadushti is there, which is causing mainly the agni mandya. So main chikitsa is targeted towards agni dipana. Okay, so here first you can go for agni dipana, then pachana, then srotoshodhana, and then only you should go for brahmana. If in such cases directly brahmana is given, as there is first only Agnimandya Sroto Dushti Rasava Sroto Srotas is blocked. So if you are directly giving Brahmana, it may not help. So Agni Deepana plays very important role. Deepana Pachana with Ushna Tikshna Dravyas like Panchakola can be given. Then give Sroto Shodhana, and then Brahmana to be given. Okay. For Sroto Shodhanartha, they have explained Abhyantara like Shringyadhigrata, Yashtyadhigrata, Tiradigrata, those are explained. These are initially given for Srotoshodhanartha. Then you can give Brahmana Dravyas. Along with that, external Snehana with Abhyanga with Lakshadi Taila is also explained. And some other preparations like to tackle Arochaka, Jwara, Chardi, Kasa, etc. They have mentioned Saindhava, Trifala, Patha, etc. drugs are to be taken mixed with the Madhu and Krita, and Lehana can be given. Along with that, there is reference of giving Ativisha, Shunthi, and Pippali along with the Madhu should be given to the baby. These help in Agnidipana, Srotoshodhana, and later we can give supplementations, Brahmanartha. The next disease under Kuposhanajanya Vyadhi is Parigarbhika. So Parigarbhika, the word meaning of Paribhava or Paribhavakya is the humiliated child. The child looks very humiliated. It looks very dull, not interested in any of the things. Okay, that is considered as Parigarbhika. So there are synonyms like Paribhava, Paribhavakya, both meaning are humiliated condition of the child. A Hindi, that is a emaciated condition. Dukta Kita, it is because of the non-nutritious breast milk. So it is considered as Parigarbhika. So Parigarbhika is Matuhu Kumaro Garbhinyam Stanyam Praya Apipannapi. That is, if the mother of a baby who is fed on the breast milk again conceives, again becomes Garbhini, Matuhu Kumaro Garbhinyam. If the mother again becomes pregnant, Stanyam Praya Apipannapi. Because of her pregnancy, she may not feed the baby, or else because of her pregnancy, because of the imbalance in the hormones and all, her breast milk may get reduced. So because of these, the baby is not fed with the breast milk. So as the baby is not fed with the breast milk, it goes for malnutrition. Along with that, as the child is not cared properly, as we all know, the breast milk is one of the milk which is having highest immunoglobulins. As the baby is deprived of the breast milk, baby's immunity will go down. So because of these all things, baby will suffer from Kaya Agni Sadha Vamatutranda Karshya Ruchi Brahmaihi. So repeatedly the baby will suffer from Agni Sadha, Vamana, Tandra, Karshya, Aruchi, Brahma and all. Yujjate Koshtorachada Tamahu Parigarbhikam. That is, as the baby is repeatedly suffering from these diseases, the baby will have Koshtovriddhi, there may be abdomen distension, there may be hepatomegaly, splenomegaly. Tamaho Parigarbhikam, such a condition where the baby is emaciated, suffering from repeated illnesses, is considered as Parigarbhika. And the main treatment for Parigarbhika is Rogam Paribhavakyam Yujja Tatra Agnideepanam. So here also main chikitsa is Agnideepanam. Okay, so in Parigarbhika or in Balashosha, main chikitsa is One is nidana. If the mother is not able to feed the baby, so supplementation to be given, which is equivalent to the mother's breast milk. Like we have no stanyam, stanya bhavam, payachagam, gavyam va. So that can be done. And along with that, you have to treat the baby for repeated illnesses. You have to increase the immunity of the child. You have to increase the appetite of the child. Later, you can supplement Brahmana Aushadis. There is similar reference in Ashtanga Sangraha, Na Garbhinyam Pivet Stanyam Parigarbhika Vridhitam. So, the breast milk of the mother or the pregnant lady is contraindicated. If it is fed, then the baby will suffer from Parigarbhika. Next, similar kind of explanation is there in case of Phakka Chikitsa that we'll see later. So, Parigarbhika is a disease where the baby is fed by the mother who is conceived again. There is no gap between two consecutive pregnancies. So first baby is still on the breast milk of the mother, and again she conceives. So because of the conception, the mother's breast milk is reduced, or because of the conception she is unable to feed the baby. So because of all these things, baby will become malnourished, and because of the malnutrition, and because of not reared properly, the baby will suffer from repeated illnesses. That is considered as parigarbhika. So the chikitsa of parigarbhika is rogam parigarbhikam yujja tatra agni deepanam. That is, if the baby suffer from parigarbhika, then agni deepana is the chikitsa. So here for deepanartha they have mentioned many ghritas like pipalyadi ghrita. So main ingredients of pipalyadi ghrita, if you are seeing, pippali mula, katukurohini, ajaji, vacha, agni. So these all are having mainly Ushna Tikshna Gunas and are Agni Deepaka, Ruchikara. So if this Grita is given, it will act as Agni Deepaka as well as Shrotoshodhana. Next, followed by this, the Brahmanas can be given. There is one reference of giving Brahmana for the child with severe malnutrition, that is Vidari, Yava, Godhoma, Pippali. So the drugs are selected, and those drugs are to be powdered, and that can be given with the milk. And to this add little extra ghee or extra sugar, and then it is considered as one of the high caloric diet, which is given in case of children with malnutrition. Okay, next disease which is explained in our class 6, that is Phakka. This is specially explained by Kashyapa. So here Kashyapacharya has explained Phakka Chikitsa Adhyaya, where it is mentioned that Phakkati Nircher Gachati iti Phakkaha. That is the baby's condition. Nircher Gachati. That is the baby's condition. Day by day it is deteriorating. It is going down. That condition is considered as Phakkaha. So the baby day by day is becoming weaker. Day by day it is becoming more malnourished. Balahat samvatsarat apannaha padabhyam yon na gachati safakaha. The baby or the child, even after attaining 1 year of the age, is unable to walk by without support. That is considered as Phakka. Generally, as we all know, the child developmental milestone, that is the walking milestone, will be developed by 1 year of the age. If because of the improper nutrition, because of not getting proper nutrition, if the child is unable to walk by even after attaining 1 year of age, then it can be considered as Phakka. Or else the child who is previously walking suffer from many diseases for a long run, and then later because of the diseases he becomes so weak that he is unable to walk. He loses that he was walking before, and because of the illnesses he becomes so weak that he is not walking. That condition can also be considered as Phakka. So, in this Phakka, there are mainly three categories or three types of Phakkas are explained. That is Kshiraja, Garbhaja, and Vyadhija. As the name suggests, Kshiraja is because of Stanyadushti, Garbhaja is because of the second early pregnancy, and third one is Vyadhija, that is because of repeated illnesses. The child become weaker. So first one is Kshiraja Phakka. Dhatrim Shleshmika Dhugda Tu Phakka Dugdha iti Samnita Tat Kshirapo Bahuvyadhi Karshat Phakkatvam Apnuya. That is Dhatri, if the feeding mother is having Shleshmika Dugdha Dushti, that is if she is having Dushita Sthanya, which is because of the Shleshmika dosha, that Dushita Sthanya is termed as Phakka Dugdha iti Samnita, that is termed as Phakka Dugdha. And if the baby drinks that milk, tat kshirapo, if the baby drinks this Phakka Dugdha, will suffer from Bahu Vyadhi, will repeatedly suffer from many different kinds of diseases, and because of the long run of diseases, baby will become Karshat Phakkatvam Apnuyat, baby will become Karsha and he will attain the Phakkata, that is the that is deteriorating condition of the baby. So here, because of the breast milk of the mother, which is Dushita with kapha, if the baby drinks this milk, he cannot digest it. So whatever milk the baby drinks is not getting digested, and the baby becomes malnourished, and he becomes weak, and he suffers from many of the illnesses, which leads to the karshata. Next one is Garbhaja Phakka. Garbhaja Phakka, as the name itself indicates, it is because of the Garbha. Garbhini Matrakaha, if a feeding mother becomes again Garbhini, becomes again pregnant, then Kshipram Stanyasya Vinivartanat, because of her pregnancy, she will stop feeding the baby who is on her breast milk, who is dependent on her for nutritional needs. So, because Shipram Stanyasya Vinivartanat, as the early weaning has been started, where the baby is not having the capacity to digest the other kind of food, in that condition, if the food is given, it is also of no use. So the baby will become Kshiyate Mriyate Vapi Sa Phakko Karpapidita. So as Chipram Stanyasya Vinivartana, that is, the baby is deprived of the breast milk, as the breast milk is the main nutritional store for the baby, or the source for the baby. If it is deprived, then baby will become kshina, baby will become malnourished, mriyate, baby will become so kshina that he may enter into the stage of mriyate. He looks like as if he is going to die. Why api sa fakko garbhapedita, that is considered as Garbhapedita Phakka or Garbhaja Phakka. Next one is the Vyadhija Phakka. That is, it is as the name itself indicates, it is because of Vyadhi. Okay, if the baby suffer from long running Vyadhis, then the baby will have Vyadhija Phakka. निज आगन्तुभिश्चैव रोज्वरादिभिः. Repeatedly, baby suffer from nija agantuja rogas. That is, either he may suffer from nija rogas or agantuja rogas, like any jwaradibihi. Anatha klishate balaha, or the baby is not cared properly. The baby is not reared properly. So, because of, as if the baby is treated like orphan babies. Klishate, anatho klishate balaha, the baby is not cared properly, then balaha kshina mamsa baladyutihi, the baby will repeatedly suffer from kshina mamsa, that is there is kshinata in the mamsa bala of the baby. That condition is termed as Vyadhija Phakka, and in this there are many features of Vyadhija Phakka, like, so those features are very clearly explained in Vyadhija Phakka. Those are like whatever features are explained in malnutrition, or almost all the features are explained in Vyadhija Phakka. Those are Samshushka Spikbahu Uru Mahodara Shiromukha. Samshushka Spikbahu. That is, the baby looks very emaciated. Very emaciated. One second. ಅಲ್ಲ ತುಂಬ ಸೊ Vyadhija Phakka. Vyadhi Phakka is the disease where mainly because of the repeated illnesses, the baby is suffering from many of the illnesses. So as the baby is repeatedly suffering from the illnesses, the nutritional status of the baby will get hampered, and because of this, the baby will look very much emaciated. Samshushka spik bahu uru mahodara shiromukha. That is, the baby is so emaciated, like he looks his spick bahu, his buttocks, his thighs, his shoulders, everything is looking very much dry, emaciated. Mahodaraha, his abdomen looks large. Shiromukha, head also looks large. Face also looks large, whereas whole body looks disproportionate. So it is one of the condition where the head is looks larger, and limbs and the upper limbs and lower limbs are looking very thin and emaciated. Pitaksho Rishitangascha Dushamana Asti Panjaraha. So here the body looks as if it is skeleton. It looks very much thin and lean. Pitakshi, there may be yellowish discoloration, there may be paleness. Rishitangascha, baby is repeatedly getting chills and all. It may be because of loss of fat all over the body. Pramlano adharakayascha nityamutra purisha krit. Pramlano adharakayascha, the adhara body, the lower body becomes so weak that he is unable to do his works. Okay, adharakaya, the lower limbs are so weak, he cannot stand properly also. Okay, nityamutra purisha krit, whatever the baby is taking, because of his agni is so manda that he cannot digest anything, and he is passing nitya mutra purisha. Repeatedly he is passing mutra purisha and all. Nishteshta adharakayo va panijanu gamo apiva. That is, his adharakaya becomes weak and it becomes nishcheshta. So he cannot stand by himself, he cannot walk by himself. He uses his pani and janu, that is, he uses his limbs, the hand and the knees, for walking purpose. He is as if crawling on the ground. He uses that technique to move from one place to another. Daurbalya manda cheshtacha mandatvat paribhutakaha. Daurbalyata, there is weakness. Manda cheshtata, the child is not interested, he becomes so weak, he is not interested. Manda cheshtata mandatvat paribhutakaha, and he is not interested in surrounding, he looks very humiliated. Generally kids want to play, want to enjoy, want to always happy mood, but here the child is so malnourished, there is no any fat for his metabolism only, so he is not at all interested in doing in any of the other activities. Daurbalyam manda cheshtacha mandatvat paribhutakah makshika krimikitanam gamyascha asanna mrutyurok. So as the baby is, or the child is sitting at one place passing low stools always, so he becomes so not hygiene is maintained. In such condition, makshika krimikitas will get attracted towards himself. So it is very miserable condition. Vishena rishtaromacha stabdaromo mahanakah. His romas, his hair are so easily pluckable. Stabda roma mahanakaha. The nails will grow very much. The organdhi malini, he looks very irritable. Malini, his not hygiene is not maintained. He becomes krodhi. For small things also, child become very irritable. Shwasati tamyati. Later, if the disease again progresses, he respires with lot of difficulty. Tamyati. Sometimes he may become drowsy also. Ati vinmutram dushikascha shinghana malodbhavaha. There is always dribbling from the nose. He always passes loose motions. He always passes repeatedly urine and all. So this condition is so miserable that child will become very much weak and he is unable to walk. This is this Vyadhi Phakka. Clearly, all the features which are explained are exact features are explained in the severe forms of PEM. That is marasmus as well as Kwashiorkor. These are the three type of Phakka. Okay. Next one is chikitsa. So in Phakka, it is always as within 1 or 2 days of weakness, the child will not become so weak that he stops walking. So it is one of the disease which is chirakare. It is not a very what acute disease. It is one of the chronic disease. So here mainly the chikitsa is mentioned is shodhana. So here you have to go for sroto shodhana. Once you have to go for koshta shuddhi also. Then only start with the agni deepana and then only give the supplementation. So first treatment depends upon the cause. If it is Tanya Dushti, go for Dushita Stanya Shodhana in mother and then give medicines for the baby also. If it is Garbhaja Phakka, you can't do anything. So start with a proper weaning technique and give the nutritious food to the baby, whatever recommended. If it is Vyadhija Phakka, along with the other supplementation, prior we have to go for Shuddhi, Koshta Shuddhi, Sroto Shuddhi, then Deepana Pachana, then supplementation. Along with the here, you have to go for some of the immune boosters also. Rasayana Dravyas are also required because the Vyadhi Kshamatva of the baby is hampered here. So what is mentioned in the classics is Kalyanakam Pibet Fakkam Shatpalam Va Yathamritam. So for Koshta Shuddhi, they have mentioned Kalyanakam. So either Snehapana with Kalyanaka Grita or Shatpala Grita or Amrita Grita can be done. Then Saptaratram Param Chaina Trivukshirena Shodhayet. So for 7 days give Snehapana, then give Vishramakala, then Trivit Kshirena Virechana. The Koshta Shuddhi need to be done with the Trivit Kshira. Later, the other chikitsas are mentioned. Okay. So, like once the Koshta is Shuddha, then the medicated ghritas are mentioned with the Rasna, Madhuka, Yashthi, those are mentioned. Then they have mentioned about Brahmanas, the Brahmana Dravyas or Brahmana Yogas like Mamsarasa, Kshira, medicated with some Deepana Pachana, Aushadis. Okay, so there is mention of Brahmi Grita, which can be given. Balla Chikitsa with Mamsa Yusha, Samskrita Dugdha, Shali Anna can be given. Orally milk medicated with the Rasna, Madhu, Grita and Taila can be given. Like that, first the shuddhi and then supplementation is mentioned, and later we get there is one more reference of as the child is not able to walk, as the child is what having weakness and has stopped walking. In such condition they have mentioned abhyanga with rajataila, do daily massage with the rajataila and then give hot water bath and then followed by this physiotherapy or making practice. The child need to be practiced about walking. So here there is a mention of trichakra fakkaratha. Okay, the one small walker need to be prepared, that is trichakra fakkaratha. Pradnya Shalpika Nirmitam Vidadyatena Shanakai Grahitva Gatim Abhyase. So daily the baby should hold it and practice walking. Later, if the condition demands, then Basti, Snehapana, Sveda, Udvartana, Vatahara Chikitsa can be done to these babies also. So, in this chapter, there is a reference of pediatric physiotherapy also. That is with Trichakra Fakkaratha. So this is the reference of Kuposhanajanya Vyadhis, that is Balashosha, Parigarbhika and Phakka. These are the references. Next about Karshya, there is no any specific explanation about Karshya. Whatever is mentioned in Charaka, that can be considered. In that, whichever are applicable for children can be studied under the heading of Karshya. Okay, so whenever it comes to management of nutritional disorders, mainly Agnimandya, Dhatukshaya, and Vatavriddhi are the main three reasons for nutritional disorders in children. So first tackle the Agni, that is by giving Agni Dipana, followed by Krimihara Chikitsa, then Brahmana and Vatanulomana can be done. Then to increase the immunity, Prashanas and Lehanas can be practiced. And along with that, as the nutrition, if the nutritional status of the child is very poor, then Methirasayan, Methirasayan can be used where the child is lagging in the studies also. Along with that, Adravya Chikitsa like education, counseling, Sattva Vijaya, those are helpful in managing nutritional disorders in children. So, common drugs used for Agni Dipana are Janyadi Churna, Trikati Churna, Chitraka Divati, Hingvashtaka Churna, Panchakola Fanta can be used. For Shodhana, Haritaki Churna can be used with Kshira, Draksharasa, Vipatikara Churna, and Vidangarishta can be used. The therapies like Mrudu Dvartana, Abhyanga, Sweda, and Bastis can be practiced. Then for Dhatu Vardhanartha, we have a lot of preparations like Ashwagandha Leha, Arvindasava, Kushmanda Valeha, Karshya Yoga, Ashwagandha Grata, Pippalya Grata, Brahchagalya Grata, Amrita Prasha Grata, Kalyanaka Grata, Chavana Prasha, all these can be given in the later stages for Dhatu Vardhanartha. Okay, so on this topic, there are a lot of studies are over, but still there is demand because the prevalence is still on the higher side. So it is one of the good area for research in pediatrics. So as per modern, we'll discuss very brief about modern about references about nutritional disorders. So same, it is under nutrition is inadequate consumption, poor absorption, or excessive losses of the nutrition from the body lead to undernutrition. Overnutrition is because of excessive intake of specific nutrients. One particular, only the child is eating only bakery foods. So daily the child is eating those only. So it is non-nutritious, but it add on to the energy. So the only the child is increasing in one particular fat accumulation in the body. So PEM, protein energy malnutrition, are a range of pathological condition resulting from relative or absolute deficiency or excess of one or more nutritions. Okay, that is considered as protein energy malnutrition. It may start very early, like in the womb only, like low birth weight, IUGR, and all, and it may be present throughout the life also. So causes in developing countries like India, poverty and population growth. Perinatal causes are the causes for low birth weight and IUGR. Dietary causes like feeding habit, faulty feeding, early cessation or continuation of the breast milk. Even after 2 years of the age, baby is not given normal family pot feeding. Still the breastfeeding is continued. So the baby is not ready to take any solid food. So malnutrition occurs. Weaning, delayed weaning, early weaning, both are the reasons. And if the child is repeatedly suffer from illness, the child is not eating, but generally during illness the requirement of the body increases. Those are some of the causes. Along with that, social causes like child is not cared properly, child is not with the parents, child is there is no gap between the or there is no child spacing, or there may be broken families may be there, like social child abuse. All these are the causes for malnutrition in children. Secondary causes may be because of some other disease, the child is suffering from some other disease, so because of that the child's nutrition is hampering. Like if the child is having congenital heart disease, so because of that the child is not repeatedly getting ill and he may become malnourished. Sometimes there may be problems like inborn errors of metabolism, malabsorption, or there may be worm infestation, or the child may be diabetic, juvenile diabetes. So these all will again hamper the child nutrition. These are secondary causes. So, how to assess the nutritional status of the child is mainly depending upon the anthropometry. Anthropometry is nothing but measuring the weight of the child, height of the child, chest circumference, head circumference, mid-arm circumference, skin fold thickness, and all. So, here by measuring these things, we have standard. That is, a 1-year child should be around 9 to 10 kg. So, compare the weight of this child with the standard, and then we can categorize the babies into mild malnutrition, moderate malnutrition, severe malnutrition, like that. Sorry. So depending upon the only weight as the criteria, and we have classification of PEM as grade 1, grade 2, grade 3, and grade 4. So here the child, if the weight of the child is between 71 to 80% of the expected weight, then he is mild malnutrition. If it is between 61 to 70, moderate. If it is between 51 to 60, severe. And if it is less than 50 percentage of the expected weight, then he falls under the category of severe malnutrition. So 1 and 2 categories can be managed, but 3 and 4 are very difficult to manage. So these are the classification as per different author, different classes, like Gomez classification, Wellcome Trust classification. Those are also almost similar classification. So nowadays by WHO we have these 3 categories. So in this, one child is normal, one child is looks shorter, and one child looks thin and lean. Okay, so here these are the main 3 things which are explained by WHO. That is stunting. Stunting means the child's low height for the age. For a 5-year child, if he should be around 100 centimeter, if height is less, then it is considered as stunting. Okay, always stunting indicator indicates the chronic malnutrition. Next is wasting. Wasting means low weight for the height. The child's height may be very good, but the weight is very less. So here the child looks thin and lean. So it always indicates acute malnutrition. The child height is good means he has grown very well till now, because of some problem. For a short period of time, he has lost his weight. So he looks thin and lean. That is wasting. And underweight is low weight for the age. It may be stunting, it may be wasting. Weight, if the child's weight is less for his age, a 5-year child should be 18 kg. If a 5-year child is only 14 kg, he is underweight. Okay, these are nowadays, these trends are commonly used by WHO. These are also indicators of malnutrition. So these are some of the PEM categories, like Kwashiorkor, nutritional marasmus, marasmic Kwashiorkor, pre-Kwashiorkor, and nutritional dwarfism. These are the classifications. Next one is mild to moderate malnutrition. So here it is initial stage of PEM, where there is a deficiency in the diet for short period of time. So our body adjusts to this. If supplementation is done, well and good, the baby will grow healthy. If supplementation is not done, then the baby will start losing, or his fat, his energy is utilized for the metabolic needs of the body. So the baby's fat is getting utilized. So he looks thin and lean. He appears disproportionate with a long body, thin limbs, unduly large head, which is explained in Vyadhi Phakka. Then his buttocks are flattened, winged scapula will be there, abdomen looks thin and distended. Okay, these are the features of mild to moderate malnutrition. Next, this is marasmus. This is the severe form of malnutrition. This comes under 3rd and 4th category of PEM. Okay, so generally seen in infants. Breastfeeding is stopped early. So because of low protein diet, the child will enter into PEM. Here, the weight of the child will be less than 60% of the expected weight. Child looks very much wasted. Okay, marked wasting will be there. Stunting, the height is also less, and no edema. Here the child looks thin, lean, dry, emaciated. Okay, some of the other symptoms, underweight will be there. The baby's face looks as if it is old man's face or monkey face. All the cheeks went inside, wrinkled face because of loss of fat. Okay, and there are skin folds over the buttocks, over the thighs and all, wrinkled skin, dry skin, inelastic skin, hair is also hypopigmented, easy pluckability will be there, distended abdomen, bony prominences, the knee joint, shoulder joint looks very prominent. Child is very irritable. Child is having ferocious appetite. He want to eat, but it is not getting utilized. It is not getting digested. Okay, along with that, there are signs of baggy pant skin. Okay, baggy pant skin means there are skin folds will be appear on the back, over the buttocks and over the thigh, and the child's look very much emaciated. Next condition is Kwashiorkor. Kwashiorkor is the condition where the child, along with the weight loss, along with the less in the nutritional status, because of excess of loss of protein from the body, there will be edema. Along with the other features of malnutrition, associated one more important feature is edema. That is, weight of the child should be between 60 to 80% of the expected weight. There is marked growth retardation, and there will be psychomotor changes. Child will become very much humiliated, not at all interested in anything. Wasting will be there, and dependent parts will be having pitting edema. So because of the edema, baby's face look moon faced. Okay, it looks little chubby and all, but it is not the actual chubbiness here. It is because of the edema. And you can appreciate muscle wasting will be there in the upper limbs, whereas lower limbs are having edema. Loss of appetite, enlarged liver will be there. Reduced protein synthesis is the main cause here. Other features are generally kwashiorkor babies are with infection, so they may suffer from diarrhea, skin infections. Repeatedly, they are getting measles, bronchopneumonia, tuberculosis like infections may be seen in the child with a kwashiorkor. Mainly 3 points to remember here is skin changes. Okay, as it is the skin become unhealthy here, the skin will become erythema, hyperpigmented, and the upper layer will start desquamation, and it leaves a hypopigmented skin. That is, peeling of the skin will be there in the picture. You can see that is termed as flaky paint dermatosis. How old building walls will have oil paints, no? As it becomes older, it starts peeling off. In the same way, here the skin also starts peeling. So the term is given as flaky paint dermatosis. And in hair changes, there will be flag sign. Flag sign means during the normal nutrition, the hair color will be normal. During the child is having severe malnutrition and all, the skin, the hair color will be, pigment will be little hypo. So because of hypo and normal color, hypo and normal color, there are bands of color change in the hair like a flag. So it is called as flag sign. Along with that, mental changes like child will become lethargy, apathetic, not interested in surrounding, not interested in eating, very much humiliated child. Okay, these are the four types of malnutrition. So, in that, coming to the treatment aspect, mild to moderate can be managed with at home only. So, dietary advice need to be given. Give something which is energy dense. Energy dense means here first only the child is not taking food. So, if you give a large quantity of the food, the baby will not take. So, give something in a small quantity only. Give one bowl of rice only, but this rice need to be made energy dense. Like by adding to this, you can add little ghee to that, you can add vegetables to that, you can add dal to that, so you can add groundnut powder to that. So one bowl of rice only is energy dense. So if the baby eats only a small bowl of rice also, the requirements are fulfilled. Or if you are giving one glass of milk, make the milk energy dense by adding ghee, by adding jaggery, by adding some protein powder to it, and make it energy dense and give it to the baby. So you have to train the mother to feed the baby. That is mild to moderate malnutrition. And checking whether our treatment is effective or no is by measuring the weight of the baby. Next one is management of severe malnutrition. Severe malnutrition, generally grade 3 and grade 4 malnutrition, that is marasmus and kwashiorkor. Here the baby need to be generally hospitalized because the child will be infective, child will be having fever, child may go for hypothermia, hypoglycemia, dehydration. So here the child need to be admitted and managed in the hospital only. Once the child is out of these all danger signs, then it can be shifted to my home, and like mild to moderate, it can be managed again. So there is a mnemonic for management of malnutrition. PEM, severe condition, is shielded. That is, S stand for sugar. So give hypoglycemia need to be tackled. H stand for hypothermia. So clothe the baby, cover the baby, so that excess of loss of energy for maintaining the temperature will be prevented. I is infections, give antibiotics, treat infection. EL is electrolyte imbalance, get in the serum electrolytes. If there is any imbalance in the electrolyte, give supplementation for that. If sodium is less, give normal saline to the baby, give salt a little extra into the food. Dehydration, if the baby is dehydrated, give supplementation, give rehydration therapy by IV fluids or ORS, then deficiencies. Later at the end, deficiencies. If baby is anemic, give iron supplement. If baby is having vitamin deficiencies, give vitamins. Like that, shielded is the thing which need to be remembered in the management of acute malnutrition. Next one is the diet management. Once the baby is out of the acute emergencies, once the baby is out of hypothermia, dehydration, shock, everything is managed. Next thing is making the baby shifted to the normal diet. So that is considered as best. That is beginning of the feeding, energy dense food, stimulation, and transfer to the home based diet. Beginning of the feeding, initially baby will not consume whatever you give, so initially you have to give little quantity of the feed, but you have to give it frequently. Once the baby accept that, best beginning of the feed to start is milk. Okay, so start giving plain milk first. If the baby accept that, no vomiting, then you start giving, make it energy dense, then give it. Once the baby is taking normal milk, energy dense, then give something semi solid to the baby. Once the baby start accepting that, then shift on to the normal diet. Okay, next, stimulation. Baby always needs love, care, and all. So give time to the baby, spend time with the baby, take the baby for normal activities like play and all, then transfer to the home based diet. Okay, so this is how much quantity of the food to be given, how many doses are required, like that. Okay, then sensory stimulation and emotional support, and then transfer the home based diet. This is very important. And criteria for discharge is weight gain. So weigh the baby. So the baby should show improvement in weight, then only that is the criteria for discharge. Along with that, if all the other problems are managed, give supplementation and then discharge the baby. And such babies who are having severe malnutrition need to be called every weekly, and they have to follow the baby for at least 6 months, so that baby again will not come back into the category of malnutrition. So here, not only the medical person, the mother's role is very important, because once the child recovered from the illness, but daily needs to be given properly, so that baby again doesn't come back to the same condition. Okay, this is about malnutrition and Kuposhanajanya Vyadhis. Then for prevention, we have a lot of programs from at family level. What can be done is exclusive breastfeeding should be encouraged, complementary feeds, that is weaning to be started at 6 months, and proper weaning, proper vaccination so that child will not suffer from any of the diseases, proper child spacing so that one child once grows normally, then only the second child need to be planned at family level. At community level, yes, we have Anganwadi workers and all, they weigh the baby, monitoring the baby, integrated health packages are there, they give in Anganwadis or at school level, no, they have a lot of programs for detection of the mild to moderate malnutrition and all. Then at national level, we have lot of works going on in this area, like they have ICDS, integrated child developmental scheme. In that they give midday meal programs are there, iron supplementation they give what anti-helminthics for worms and all. So these all, and they give Anganwadi, they give food for the weaning period, food for the preschool children, for school children, like that we have a lot of national programs. If these are effective, then there is no any chance of malnutrition. So coming to the conclusion, nutrition is very important and highly discussed topic in pediatrics, and early detection and early intervention plays very important role. And mild to moderate needs adequate diet and supplementation of energy dense feeds, whereas severe malnutrition need emergency management. Then as per Ayurveda, yes, Agnidipana, Srotoshodhana, and then Brahmana is the line of treatment. So if this is implement, whatever modern or allopathic side, they are giving only the supplementation, but our drugs will help in proper assimilation, absorption, and also though if we implement those in the present trend, it may be more helpful. Okay, this is about Kuposhanajanya Vyadhi, and generally for exam going batch, Kuposhanajanya Vyadhi is one of the important topic. You may get a long question like explain Kuposhanajanya Vyadhi along with its management, like that you may get. Or in 5 marks and all, you may get a question like what is Balashosha, explain it along with the modern correlation. Then what is Phakka, what is management of Phakka. Or you may get directly management of PEM, what is the difference between Kwashiorkor and marasmus, like that you may get questions. Sure, there will be at least 10 marks of questions from this Kuposhanajanya Vyadhis. Okay, this is about Kuposhanajanya Vyadhis in children. Thank you.
Thank you, ma'am, for such an insightful session. Being
Thank
myself
you.
a student, um, we literally had like a gist of the topic and complete understanding of the topic, precise and clear. So we are really grateful to you. You took off your time despite in spite of your busy schedule and other commitments. You agreed to take a session for the third year students ongoing exam going batch. So we are really,
Thank
really
you.
grateful to you, ma'am. If we will be posting this on YouTube and on our WhatsApp group too. So if any student
Yeah.
has any questions, I will be forwarding the same to you, ma'am. Whenever you are free, if you send the answers, I will forward it to them, ma'am. And
Yes, yes.
Panchajanya is really grateful to host you today, and we look forward to collaborate with you even more and host some more programs, bring some more initiatives for the welfare of Ayurveda and the culture of Bharata in the future, ma'am.
Thank you. Thank you for giving me this opportunity. Thank you.
Thank you, ma'am.
Yeah, thank you.